Story 1. The public option should be direct care, not subsidized insurance. It is unlikely that giving insurance companies more money will result in expanded coverage, so they must be bypassed to make public healthcare available. Story 2. Healthcare administrative costs need to be reduced drastically. Hospitals should make all costs transparent, such as ambulance rides. Story 3. Assurance and a plan to maintain the quality of care available. Story 4. I am generally in favor of universal health care, but I have one question. It is a recurring theme in many European countries and others that have implemented a single-payer system, similar to Social Security, but even more vulnerable. Universal health care can become the national budget's punching bag. Suppose it succeeds in providing the baby boomer generation and Generation X with comfort by the time millennials and younger generations inherit it. How do we ensure we do not inherit a system whose budget has been constrained by 7 government shutdowns, where each compromise cut additional billions or trillions from the funds earmarked for the universal healthcare system? Story 5. For me to support universal healthcare, I would need to see a plan. The proposals I have seen are not that. They are universal insurance plans, which is not the same thing. If you think it is, try getting a non-emergency procedure done without the money for the copay, coinsurance, or deductible. I am in favor of the government directly helping people. I believe that is its mission. I am not a fan of using my taxpayer money to subsidize or pay for insurance products that do nothing but enrich a wealthy industry. Story 6. I support single-payer healthcare, but at this point I do not know whether I can trust the federal government to fund it, so that it remains an effective public health system. Story 7. This isn't a support issue. It's a lobbying issue. We were supposed to get a public option in the Affordable Care Act, but the insurance companies objected and the provision was removed. Story 8. I would like to see it implemented by the states. California can go first. Story 9. They do not understand that it would be less expensive than what they are currently paying. It is a failure of education. Story 10. Keep politicians out of it. Decisions about people's health care should be made by doctors and scientists. Story 11. I would want it entirely independent of the federal government. My apathy toward this has nothing to do with what it does or does not have and everything to do with a distrust that the federal government can act without being counterproductive. Story 12. I would not support any universal healthcare system administered by the federal government. I believe the government is incompetent, and I do not want it responsible for my health. The only broadly universal solution I would support is a federal law stating that any insurer that agrees to cover a specified minimum set of benefits and provides a transparent, public pricing and payment schedule may offer health insurance anywhere in the country to anyone, with residents of the United States treated as the insured group. No government mandate, subsidy, tax, or regulatory agency would be involved beyond establishing the specified minimum coverage. Story 13. I support universal health care as someone who lives in a country with universal health care, but I think some non-emergency health services that allow consumer choice should be provided privately to preserve efficiency while remaining mostly government-funded. Sweden already does this to some extent. Fully nationalized universal health care is too easy to politicize and can become inefficient. I want to avoid a situation like the National Health Service, which, despite praise from many Americans, has increasingly failed to provide basic services because of administrative bloat, technical debt, and growing inefficiencies. These problems have driven up costs so that the system is chronically underfunded, not because the British government spends less per capita than its neighbors, but because much of every pound is absorbed by maintaining legacy infrastructure, supporting an expanding bureaucracy, and other functions unrelated to patient care. Story 14. I support a plan to provide an affordable, quality private healthcare option alongside a government-run option. By affordable, I mean affordable for the average middle-class American. I want the government as far away from my healthcare as possible, and I will not support a government-run system unless a reliable private option exists. Story 15. It's not that I do not like or understand the concept of universal healthcare, but here in the United States, officials have held people's food stamps hostage during the month of Thanksgiving to try to push through a terrible agenda. Can you imagine what a bad actor could do if they had your health as a bargaining chip? They could restrict healthcare access even more than they already are by saying things like, "Sorry, no birth control for anybody. We will not use tax money to pay for it." In an ideal, properly funded, well-resourced system, that would be amazing. In the current reality, no thanks. Story 16. Massive, effective cost controls. The United States system subsidizes excessively high medical costs across the board. When the government pays the bill, medical providers may raise prices to the level the government is willing to cover. Story 17. The most dangerous thing about single-payer healthcare is that it places healthcare in the hands of the government, enabling politicians acting in bad faith to control it. The United States would need a new constitution, or at least a second Bill of Rights, clearly defining the government's responsibilities to the people and implementing reforms to combat corruption and increase accountability for officials at all levels. Story 18. Nothing. It is something the government controls and can take away. Story 19. I would have to be promised a raise equal to my employer's portion of my current insurance, and universal healthcare would have to be better than my employer-subsidized coverage. Either of those is highly unlikely. Story 20. In the United States, to make the system work, we would need to adopt the philosophy most other nations follow and control costs. We must stop assuming that everyone should automatically receive the latest, most expensive treatments regardless of benefit. A large share of healthcare spending occurs in the last 6 months of life. This contrasts with other countries. We could no longer spend millions to keep an elderly relative alive on machines for another 2 weeks unless people paid for that care. That would require a major cultural change. Story 21. Quality of care is important. I broke my leg in December and needed surgery. The break happened on a Friday. I had a consultation with the surgeon on Monday and surgery on Thursday. The initial appointment and every follow-up appointment were with the doctor who operated on me. A quick search for Broken Leg Surgery Canada shows a post from the Reddit community Ontario that stands out. I broke my arm on Sunday, July 14th. I went to the emergency room that same day and got a referral for the fracture clinic for the following day, Monday. The emergency room doctor estimated surgery to be within the next few days. I went on Monday, and they told us they moved our appointment to Tuesday morning. I went on Tuesday and the surgeon put me on the trauma list. This hospital does not give definitive dates for surgery. All they said was that every morning they would call to let you know if your surgery was that day. So do not eat or drink the night before. The doctor gave me an estimate for the weekend. I decided their answer was not definitive, so I went to a different hospital to see if they could schedule me earlier. They told me Tuesday the 23rd. I got a call that they moved me to Friday the 26th. The first hospital called every day, so I asked them for a transparent answer. They said to go with the second hospital because they did not know and were now estimating at least another week from July 19th. Is this normal for Ontario? I have a spiral fracture of my humerus, which cannot heal without surgery. I am in immense pain and completely bedridden. A comment on that post. My appendix ruptured last year. I went to the emergency room at 8 a.m. I was not wheeled into surgery until 6 a.m. the next morning. I stayed in the hospital for a week because the appendix had leaked toxins into my body and I was very ill. While in the emergency room, they took me for an ultrasound. When I came back, there were not enough chairs in the emergency room, so I had to stand against the wall with my morphine drip. Let me tell you, standing or sitting with a ruptured appendix is not fun. The fetal position is the only position that is bearable. As I was standing there, a nurse walked past and, in a sing-song voice, said to remember this next time we vote for the premier. I did not need the reminder. I will not forget. Story 22. I would not mind seeing incentives for people who are fit and healthy, such as tax breaks or discounts on groceries. Story 23. I am from a country with universal health care. I think politicians must be honest about artificially capping doctors' and nurses' wages. Healthcare is expensive for a reason. One of the largest contributors, in my opinion, is that it is a service provided by some of the most educated people in a society, doctors and nurses, and it must be accessible to everyone, including the poorest. The math does not allow the poorest people good access to the labor of the highest paid professionals if those personnel are paid market wages. Let us talk about the United States, since that is what people often argue about. The United States has among the highest wages for its skilled workforce. In many other countries, engineers, lawyers, and executives probably earn 3 to 5 times the median wage. In the United States, that figure can easily be 5 to 10 times or more. These are approximate figures to illustrate the idea. The only way to solve this is through government-mandated price controls, which reduce earnings for doctors and nurses to some extent. They would still be middle to upper middle class professions. Whether this trade-off is worthwhile for society is for people in the United States to decide. Story 24. I do not support universal health care because I do not believe it is the role of the government, but I think the United States needs to seriously consider it. How can we fix the Department of Veterans Affairs and Medicare so they work better and can be expanded with as few problems as possible? Story 25. My mom was looking at prescription coverage last night because her old plan was canceled after changes to the Medicare prescription drug plan. $200,000 is the starting price for annual premiums. Good luck, America. Story 26. Assurance is needed that reimbursement rates for hospitals are not as low as Medicare rates. I have seen what happens to hospitals with a majority of Medicare and Medicaid patients. They tend to collapse and close without enough privately insured patients. The last hospital where I worked is now a parking lot for a casino. I would like everyone to have health care and be able to afford it, but we must be realistic about the costs. Story 27. Transparency from providers about how much a procedure or visit will cost before it occurs. Story 28. I do not want the amount I pay to rise, and I definitely do not want the time it takes to see a healthcare provider to increase. Both have already risen to obscene levels under the Affordable Care Act. Story 29. I support universal health care 100%, but I would like it to include 1. An overhaul of medical training practices, specifically the torturous hours. 2. Forgiveness of all medical education debt upon successful accreditation and completion of a period of public health service. 3. Funding for students to pursue medical degrees. 4. Comprehensive rural health care services that meet community needs. 5. Dental care. Story 30. There is nothing that could be added to get me on board. In countries that have universal health care, there are long wait times and lower quality of care, fewer medical innovations, and less advanced facilities and technology. Why would anyone want subpar care? Why would doctors go into debt for schooling and work long hours to become the best, only to effectively work for the government? Story 31. A definition, without it, it is just a blank check. Will taxpayers provide organ transplants to 90-year-olds in hopes of extending their lives by another 6 months? Story 32. Anyone who does not support universal health care is heavily propagandized. Story 33. People need to learn that insurance companies are corrupt middlemen, inflating medical costs and diverting tax dollars. We can more easily pay for health care for everyone and appropriately compensate the professionals who provide it if we stop allowing people to become billionaires by manipulating the price of medical care and billing the government. Story 34. Considering how incompetent typical government-run entities are, it will never work. Additionally, if you look at welfare and food stamps, it is potentially just another way for criminals to take advantage of the government's incompetence. Story 35. A 3.5% payroll tax split, equally between employees and employers, would cover it. No tax for anyone earning under $30,000, and no upper income limit. Also, a 2% tax on dividends and capital gains, and a 5% tax on wages over $2 million. Companies have lost the ability to differentiate by offering health insurance as a benefit. As a result, companies are more likely to support a 3.5% payroll tax rather than continuing self-funded or group plan costs. Story 36. People want free stuff for themselves, but they do not want to pay anything so others can have it. Story 37. I grew up in Sweden. The public health system was poor, and my father had to pay over 65% of his income for it. They switched to a 2-tier system, which I prefer. The copay is higher, but you can make appointments and the facilities are nicer. I like my coverage in the United States. It costs about $600 per month for the family, and the employer pays part of it. There is about a $10 copay for office visits and a $20 copay for private visits. Story 38. Overall, Americans are experiencing severe weight loss. Supporting an obese population costs more money. Story 39. Dental coverage. I support universal health care, but many places do not include dental benefits. Story 40. The Department of Veterans Affairs provides government health care for veterans, and from what I have heard, it is not run well. If it cannot figure out how to make it work for service members and veterans, how much better will it be for the rest of us? Story 41. Lower costs from providers. They are currently overcharging customers whether they pay with insurance or out of pocket. Once these costs are under control, paying for them will be much less of a burden for taxpayers. Story 42. I currently support it, and I want every aspect of healthcare, including ambulances, hospital operations, and pharmacies, to be federalized or required to operate as nonprofit organizations. The profit motive should be removed from healthcare entirely. Story 43. My objection to universal healthcare is that it makes me pay for the poor health decisions of other people. I mean decisions. I do not object to paying for someone who caught pneumonia. I do object to paying for a smoker's lung cancer treatment. The problem is that over 2/3 of Americans are obese, so a large portion of our national medical expenses is driven by people's poor health choices. Story 44. Give a single example of a country where universal healthcare works well without an absurd tax burden and without wealthy people purchasing private insurance because the public system is inadequate. I have lived under universal healthcare, and it is much worse compared with what the United States has. The United States system was far better and cheaper before the Affordable Care Act, but even after the Affordable Care Act, it remains far superior to universal healthcare. Story 45. To people who tolerate their taxes being used to pay huge military expenses because it protects Americans, what would protect Americans more than everyone having healthcare? Story 46. I support it now, but I would like to see it include dentists and eye doctors. Story 47. Tight requirements for quality of service, including timeliness with no waiting 2 months, customer satisfaction within reason because it is healthcare, and quality of outcomes. Capping billing or payment overhead at 3 to 5% in the modern paperless era should be fine. Money should pay for health services, not bureaucratic overhead. If you think this is not doable, it is already being done. Story 48. I am a supporter of Make America Great Again, but I would support universal catastrophic coverage. Begin by covering cancer nationwide. No one should go bankrupt because they have cancer. Focusing on catastrophic coverage reduces concerns about cost because it represents a small percent of total care and limits government involvement in healthcare unless someone truly needs help. Start with that, see if it is reasonably popular, and expand to less severe conditions over time. Imagine the political ads you could run against politicians who oppose covering cancer care for a sick child. Story 49. A sort of fuckwit fine where people who use healthcare resources for entirely avoidable problems or problems that are not medical pay the full cost. Story 50. I don't support it. I don't believe in forcing people to hand over their hard-earned money at gunpoint to a large number of people who will take it for granted and feel entitled to it. Once universal healthcare is established, progressives will continue to push for additional policies. They will then focus on the next issue to take from one group and give to another while claiming moral superiority. What is stopping Democratic-run states from mandating a state-run healthcare system? Why does California not set up the system and establish each county hospital as a universal healthcare access point? For your information, both systems can operate at the same time. Story 51. It must not raise my taxes or reduce my current coverage, and there must be no waiting lists for the emergency room. Story 52. It would be paid for by taxing the hell out of billionaires. Story 53. It's not a matter of including more. That is a pipe dream. There need to be steps to make it feasible. It is not attainable simply by taxing the majority of what you think the wealthy have available. There is an issue with healthcare costs. The whole system needs to be overhauled and rebuilt, and neither party cares to do anything but bow to lobbyists and the system. I don't know. Maybe Bernie Sanders would have been willing to approach this, but no other presidential candidates cared to. if costs and profits for the healthcare complex do not come down and become more moral and ethical, universal healthcare is a poor idea given how much money can be wasted. It is also worth noting that everything the government touches often ends up poorly managed. Is the Department of Veterans Affairs a good example of what people seeking universal healthcare want? In my opinion, it is not worth pursuing unless policymakers are truly willing to take the necessary steps, not just rally about it, do nothing, and print more money. To obtain health and prosperity in America, you need to secure employment and income. Do not sit back expecting a dysfunctional government to help you. Strive for it as if your life depends on it. Story 54. I want to see a plan to reduce the American Medical Association's stranglehold on medical education so we can train more physicians and ensure a consistent level of care as demand increases. Story 55. I would support it if we locked down the border and deported every single undocumented immigrant in the country. Story 56. I would need to see the government get the fuck out of healthcare and fail under the free market before I would support universal healthcare. Story 57. I would like to see a major increase in preventive efforts such as taxing processed foods, reducing soda consumption, and lowering saturated fat intake. Looking at you, Robert F. Kennedy Jr. Obesity and heart disease are expensive to manage, and if everyone shares the cost of care, obesity needs to be treated as a public health crisis similar to smoking and lung cancer. The idea that it does not affect you is false. It affects everyone who pays into the system. Story 58. A complete revision of the United States tax code is necessary. Otherwise, the middle class would pay by far the largest portion of the cost relative to their income. Story 59. I would need the same level of choice and flexibility I have now. For example, I can choose from more than 100 doctors, evaluate them, and select the best. If I do not like one, I can get another opinion. If the wait is too long, I call around and find someone with no wait. I have never waited more than a week for a specialist. I do not think that level of flexibility can be maintained under universal healthcare. I calculated taxes in other countries, and I actually pay less here in the United States than I would pay for the National Health Service as a percentage of my income. I do not want to pay more in taxes for a worse product. Story 60. I would support universal healthcare if it ensured high-quality care while staying financially sustainable. That means strong cost control measures, efficient use of resources, and accountability for outcomes, not just expanding coverage. Story 61. I used to support universal healthcare. Now I do not support it for Trump voters. Story 62. I support universal healthcare in the United States, but hearing how difficult it can be to get care in other countries gives me pause. I see posts about people in Canada waiting years to be assigned a doctor, being stuck with that doctor even if they dislike them, and never being able to get sick visits. Meanwhile, I can walk to 5 different urgent care and walk-in centers in less than 10 minutes and be seen within half an hour. I know this is not typical of the whole United States, but I think places that have difficulty accessing healthcare now would still have difficulty under a universal system. I live in a city. Rural areas would have fewer options. I hear it is difficult in places like Toronto. I know that general doctor visits can be cost prohibitive for some. I am lucky and have made choices to maximize insurance coverage, but those options do not seem as available in Canada. For those in countries with universal healthcare in dense urban areas, how hard is it to walk into a clinic and be seen the same day? Story 63. It should be paid in proportion to use, not to a person's income or wealth. Right now, whether you are a minimum wage retail worker or an attorney earning $900,000 a year, you pay essentially the same for healthcare. A premium, deductibles, and copayments. Under a universal system, it would be paid for through taxes, which are almost always progressive. That is my concern. The attorney does not owe the retail worker a debt. Story 64. I support universal healthcare with the complete dismantling of the health insurance industry. Story 65. A government that is not susceptible to the whims of foolish voters. Story 66. Universal healthcare sounds great until you factor in the reality that you are subsidizing 70% of the United States population that is overweight or worse, including alcoholics and other drug users, the excessively promiscuous with sexually transmitted diseases, and those who lead reckless lifestyles. People who live straight and narrow lives already suffer the consequences of others' behavior. Why make it even worse for them? Story 67. I do not want my taxes to increase. If we adopt socialized healthcare, I will pay more for an equivalent or worse service. I earn more than $1 million right now, so I already pay a large amount in taxes. Story 68. Total obliteration. I think health insurance should not be private anymore. Story 69. Seeing how high taxes are in countries with free healthcare, I will never support it. Story 70. Most of us suppose I am afraid that about 75 million people would have to become very sick at the same time. Story 71. I support the idea, but reducing direct healthcare costs would make it more feasible, especially if we reduce the need for individual insurance. That is a separate issue. Dental and vision should be covered because they are part of healthcare. I am stunned that the United States has never implemented universal healthcare. The country often takes concepts, modifies them, and rebrands them, but this has only been implemented in a limited way. Instead of funding everything except health and education, we should prioritize those areas. Story 72. Honestly, I have soured on universal healthcare because I do not trust Americans to vote in enough people to make it happen, and that is just the beginning. The first time Republicans regained control of the government from whatever hypothetical administration created universal healthcare, they would do their level best to rip its funding apart. You would have to hold power long enough for the concept to sink in so people would be outraged if it were taken away. You would also need to control the Supreme Court so it cannot neuter the law, which requires the luck of having justices retire or die during your administration. Basically, I would need the government and American society not to be set up in a way that prevents something like universal health care from ever happening. Story 73. Find a way to replace the profit motive that drives a lot of medical innovation and I'll be on board. Stable government funding and relying on people's good nature are not valid replacements. Story 74. Probably clearer plans on funding and how they'll prevent system abuse. Story 75. I want to see the numbers and how it affects both costs and taxes. I can be persuaded. I do not need healthcare, so it does not benefit me personally. Story 76. I support the concept in principle. I do not believe it is possible in the United States without a years or decades-long upheaval that might cause the system to stop functioning altogether. I understand how systems in other countries work. How much do doctors in those countries earn? Would physicians in the United States accept that level of pay, even if their substantial education debts were forgiven? That is another system that needs overhaul. The American Medical Association already artificially limits the number of physicians by restricting residency positions to keep salaries high. If the American Medical Association is not on board, the concept is going nowhere. Story 77. Simple. It is not run by the United States government. For-profit systems are being forced out of healthcare. No private equity buying hospitals, no politicians deciding the standard of care, and no pay and pursue. Story 78. Well, if I were to get really sick, then I would want health care. But since I am not sick, I do not see why this is such a big deal, said every conservative ever. Story 79. I would like to see an actual plan. Many people say free healthcare as if it would be easy to implement. I know several people who moved to the United States from European countries or Canada, citing poor healthcare where they came from. I support free healthcare in principle, but I do not trust the government to implement it. I worry it would be more broken than the current privatized system. I prefer affordable healthcare unless someone can propose a viable plan for free healthcare that does not raise my taxes by 50%. Story 80. The obvious solution is to create a public healthcare option that covers children ages 0 to 18. The optics of denying children with cancer access to cancer-free healthcare would be a death knell for any politician who opposes it. Run a series of St. Jude commercials declaring, "Stop cancer." Because if there is something people hate more than the other political party, it is cancer. Place all children on Medicaid by default. Families may opt out by enrolling in a family plan through an employer, but baseline coverage should apply to all children. Next, make exemptions for ages 18 to 25 who enroll in trade schools or colleges. With an entire generation protected by a public option, When those ages 18 to 25 become politically relevant, they will vote to preserve a lasting public option. Story 81. Fraud must be taken seriously, whether committed by a patient, doctor, or insurance agent. Story 82. We do not need universal health care. We need to lower the cost of medical care to an affordable level. This is not difficult. Pass legislation requiring any healthcare facility or insurance company that receives any government funding, including state and local funds, or tax abatements and similar incentives, to be nonprofit entities. Any surplus must be designated for facility improvements and not for salaries, bonuses, or other distributions. Executive pay would be capped at a fixed multiple of the lowest paid employee's salary. The current healthcare system allows executives to collect large salaries at the expense of patient care and lower-level employees. Story 83. A complete overhaul of the insurance and care management system. Story 84. I would support it in a heartbeat if it came with price transparency across the board. No more opaque ambulance bills and a ruthless axe to the insane administrative bloat. We are talking 25% of costs on paperwork versus 3% in other countries. Fix those, and we would actually save money while saving lives. Story 85. Medicaid should be provided by the United States government for every United States citizen child born on or after January 1, 2030. Implementing this in the middle of a new presidential term could reduce partisan conflict, because most people would support covering newborns. Incremental change is preferable. Suddenly converting to a fully government-run healthcare system would be too disruptive. This approach could work, and after 10 to 15 years, it might be possible to consider expanding coverage to everyone. I know this is not the immediate solution the original poster wants for everyone, but a gradual approach like this is the most realistic way to make it work. Story 86. Provide details. Everywhere else, it has flaws, and I want you to address those and explain how it will be better here. Most of all, do not lie to me. I am okay with being personally a little worse off if it substantially improves the lives of those less fortunate. Story 87. I would first cut a lot of the paperwork. Most of the time, doctors are tied up with paperwork. I would limit universal health care to actual emergencies and urgent care needs, such as a virus, an infection, a severe reaction, or a broken bone. For anything beyond that, private insurance would still be available. Story 88. Show me a history and pattern of federal or state governments efficiently managing resources that provided an excellent product and outstanding customer service, with waste and corruption shrinking over time. A product or service so good I would voluntarily sign up and subscribe to it versus my resources being extorted under threat of violence. Story 89. Costs are out of control. Universal health care would only make it worse. The only difference is how we would pay for it. Put proper regulation in place to control costs while maintaining quality. Then we will talk. Story 90. We often see stories about aspirin costing $300. That nonsense must be eliminated. Story 91. I think the following should be done. 1. Big pharmaceutical companies should be prohibited from airing television commercials. 2. Big pharmaceutical companies should be prohibited from sponsoring any sports team, arena, or similar organization. 3. Big pharmaceutical companies should not be allowed to donate to political campaigns directly or indirectly. The cost of healthcare is directly related to big pharmaceutical companies, as I understand it. Story 92. People should improve their health and care for themselves to help reduce costs for everyone. The government must provide programs that run efficiently with streamlined services and processes. Story 93. It would provide quality healthcare to more people at a lower cost, and people could opt out and still use private healthcare if they wished. Story 94. I think you're asking the question wrong. I support the idea of universal healthcare, but not the way it is being implemented. 1. Insurance companies being involved in the Affordable Care Act killed what President Obama was originally trying to do. 2. If you are talking about universal health care without discussing eliminating Medicaid, Medicare, and Veterans Affairs health services, then I do not support that. The simple fact is that if we get rid of all our current healthcare subsidies and remove the payouts to insurance companies, We could easily pay for universal health care, and I am all for that. If you are trying to tell me that we need to tax more or do all this incremental stuff, then I am not for it. Story 95. A dedicated express lane for people who searched their symptoms and are now certain they have scurvy. I don't need a diagnosis. I just need someone in a lab coat to gently tell me I'm an idiot and suggest I eat an orange. Story 96. A dedicated express lane for when you Google your symptoms and convince yourself you have 12 hours to live. I need that specific brand of anxiety treated immediately. Story 97. I'm not signing on until the little paper gowns they give you are replaced with at least a Jedi robe. I want to discuss my weird rash with the dignity of a space wizard. Story 98. Provide incentives for individuals to maintain their health and reduce costs. For example, people who smoke or who are severely overweight should not qualify for public health plans. If you want free care, take the steps necessary to stay healthy. Story 99. I do not support taking the existing system in the United States and simply converting it to a single-payer system. If we do not completely rebuild the administrative, billing, and insurance systems from the ground up and address pharmaceutical companies and hospital equipment manufacturers, then single-payer healthcare would be completely unaffordable. Story 100. I would be on board if it guaranteed decent wait times and did not tank the quality of care. Universal coverage should not mean universally worse service. Story 101. Healthcare is a mess. Ambulance rides that cost $500 need price tags up front. Quality is key. Without it, universal coverage becomes a larger bill. Streamline administrative bloat first, or we are all in trouble. Story 102. Healthcare workers need a guarantee of higher than average pay for their specialized education. Story 103. Those against it will not change their minds. They enjoy others' suffering. Story 104. How will it be paid for? How will reimbursements be determined? What will it cover? Story 105. Allow private insurance to be the primary payer and make university hospitals the secondary payer. Story 106. Right now, address the cost barriers to the education and training required to become a medical professional. Story 107. Take it from a Canadian. It is good if it can be maintained and scaled properly. Story 108. Crushing medical bills and a lack of medical care seem to do the trick for most people. Story 109. I once paid $200 for a doctor to look me dead in the eye and tell me to drink more water. I want that money back with interest. Then we can talk. Story 110. This needs to stop shifting from, I support it, but, to just do it. I know there are issues, but insurance is so inefficient. The hidden cost of healthcare administrative fees is killing us. Universal healthcare essentially eliminates that 5,000-page book of medical billing codes and replaces it with 50 pages of supply order codes. Nobody knows the true cost of medical care because we do not confront those costs properly. If you eliminate the process, things will adjust naturally. Story 111. I once received a bill for $80 for a single Tylenol. If universal health care can beat that high score, I am sold. Story 112. Transparent pricing. A comprehensive list of excluded care. I do not think it is society's responsibility to fund cosmetic procedures, for example. Estimated wait times for each category of care. Will universal health care mean that I have to wait weeks or months to see my doctor? Story 113. Accountability must be present, with strict standards of care that require adequate staffing to match population changes and transparency at every level. Run it as a utility with needs analyzed and adjusted constantly, and with adequate facilities, equipment, and staffing. Story 114. 100% coverage for the life-threatening, difficult-to-treat condition that has suddenly befallen me or someone I love and that threatens to bankrupt me even with health insurance. So, basically, the only thing 96.2% guaranteed to actually bring a modern American conservative around on a topic is a direct personal impact. Story 115. I would need to see a comprehensive plan for changing education costs, reimbursement, and tax structures. If Medicare for all is imposed, it will be awful. Story 116. We will not see universal health care anytime soon. They have been working on full privatization of healthcare for the past 50 years. They are almost there. Story 117. I do not trust the government at any level to create or administer a functional universal healthcare plan, nor to avoid politicizing it later. I would not oppose such a plan if it were done properly, but recent history gives no reason to believe either political party is trustworthy. Story 118. I support universal healthcare, but I favor a slower transition from our current system to that model. Because insurance companies employ many people, a gradual change will soften the economic impact in communities where an insurer is a major employer. Story 119. If participation were not compulsory, I would support it. If you opt in, you will be taxed accordingly and become eligible for universal healthcare as defined by the authorities. Those who do not pay the tax are not eligible. Everybody wins in this scenario. Story 120. The sudden appearance of a magic elf who would pay the actual cash costs needed to maintain or improve current quality and accessibility. Story 121. When someone proposes a plan, they should be honest about its gaps and faults. For example, we will improve in areas A, B, and C, but the risks are X, Y, and Z. It is not always sunshine and rainbows. Story 122. Provide a justification for why a person should receive more health care than they pay for in taxes, or propose mechanisms to ensure a person cannot receive more health care than their contributions warrant. Provide a justification for why health care should not be for profit when that is the stated purpose of a business. Story 123. If a doctor says a patient needs a treatment, the patient should not have to go through so much just to get it covered when it is a matter of life. Cosmetic treatments are not medically necessary. Insulin and cancer medications are. It is unreasonable to require physicians who do not understand a specific field of medicine to approve or deny treatments outside their specialty. An obstetrician-gynecologist should not make decisions for cardiology. If a physician does not know the medications and conditions, they are not qualified to make those determinations. Story 124. I strongly support universal health care. I admit this is somewhat selfish. On the whole, doctors in the United States of America are paid roughly as much as doctors in other countries, compared with salary differences in other fields such as teachers in Canada and the United States, though we work more hours. Most of us owe a great deal in student loans. We all completed 4 years of undergraduate study, 4 years of medical school, and at least 3 years of residency. If we transition to a universal healthcare system, I would want to see protections for doctors' salaries. Story 125. You cannot have universal healthcare when you do not have universal health. I do not think I could ever support it. If there were a way to remove people from it for extremely poor health choices which would defeat the purpose, or at least to not cover conditions resulting from poor life choices like smoking or severe obesity that raises a problem, that would leave the government deciding who does and does not deserve care, which is one of the main reasons I could not support it. The current system is probably the worst. We pretend we have a free market so people can hide unethical practices, but those unethical practices are encouraged and subsidized by the government. Story 126. I am all in for universal health care. Right now, our tax dollars are going into billionaires' pockets. I would like to see them do some good for once. Story 127. Something to replace the more than 900,000 jobs that would cease to exist in the insurance industry. Story 128. The big benefit I see of universal health care is having it controlled by a single agency that can truly tackle the large-scale issues in the healthcare system. I would like to see an actionable, well-thought-out, realistic plan for how healthcare costs will be significantly reduced. I want clear, concrete steps and planned actions, not just theories and end goals. Story 129. I think universal healthcare is one of the few things the government should be focusing on, and its benefits would easily repay the investment. My main concern is that I do not trust the government to fund it properly. It would become another tax on the middle class that could be diverted to unrelated policies, as happened with Social Security. Too many representatives from both parties are bankrolled by the pharmaceutical and healthcare industries. I do not trust them to avoid handing out blank checks to their friends. Story 130. For me, it boils down to a few reasons. First, Medicare is a disaster. Anyone who works with Medicare or has worked with it knows the program frequently drops the ball. If everyone were covered by it, those problems would likely increase tenfold. Second, the healthcare system as a whole is broken at its core. Costs are out of control at all levels and are being passed to consumers. I feel sympathy for insurance companies when they see the costs passed to them. Transitioning to universal health care requires significant cost reductions not only in hospitals but also in pharmaceuticals and suppliers. This could have major economic impacts, such as doctors taking significant pay cuts despite carrying hundreds of thousands of dollars in student loans. Third, quality of care is a concern tied to the previous point. The political right highlights Canadian wait times, and they are not entirely wrong. An average wait time of 30 weeks for some procedures is astonishing. I saw my doctor last week and they scheduled a procedure for me next week. I could not imagine waiting 28 additional weeks. The United States is losing ground on this issue because shortages, hospital closures, and rising demand are driving wait times up. So the country may eventually face similar problems. Story 131. Paid for entirely by billionaires. All medical care is included, including vision care such as laser-assisted in situ keratomileusis and dental implants. Story 132. Universal healthcare is the vaguest phrase in the world. There is no single plan, and the devil is in the details. Story 133. Universal healthcare is not a viable option in the United States. It is effectively impossible to implement because the country lacks the necessary conditions. Many people blame insurance companies and corporate executives, but if you cannot afford over-the-counter medicines, the problem is not the insurers. The real problems are the litigation culture, the high salaries of healthcare providers, and the cost of advanced medical technology. Those factors are extremely difficult to change. Story 134. Hey everyone. The government has been shut down for almost a month. Let that sink in. Imagine if healthcare were shut down. Story 135. Firms and corporations listed on Wall Street are banned from any related profit potential. Story 136. My parents are both veterans, and the Department of Veterans Affairs is a mess. If the government can fix that, I'd feel better about it. It mostly seems like administrative issues. Story 137. I went to my local CVS pharmacy the other day. Because CVS pharmacy values profit over service, I waited for the single pharmacist on duty to assist me. She was talking to an older woman, telling her how Medicare Advantage is the best thing ever, just like Medicare, but with extra benefits such as free prescription drugs. At the time, I did not know she was the pharmacist until she came over to me. I was in a hurry, and I regret that I did not tell the older woman there are places that provide unbiased, non-profit explanations of Medicare Advantage. Story 138. I'm speaking broadly, but from what I've heard, those who oppose it often do so because they do not want others to receive something they feel they did not earn. I think of the Lewis clip where his daughter complained that her sister got more food, and Lewis replied that we don't say they got too much. We ask whether they got enough. Story 139. I wonder if a good compromise would be that basic and preventive care could be universal, while major services remain private. I do not know. I realize that would be complicated, but I feel it could help and would not be such a drastic change. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.